Well, tell me a little bit about the American Board of Allergy. What is it?
We are a medical certification board. We assure the public that doctors are meeting the current standards in the field of allergy and immunology. We've been around since 1971. We're part of the American Board of Medical Specialties. There's a number of boards, and we're the allergy and immunology one. We give a certification examination, and then we ask that doctors maintain their certification. There's four parts of maintenance of certification with multiple components in each part to assess the doctor's professionalism, knowledge, and lifelong learning.
Well,
in a nutshell.
It's nice to know that the doctors have those qualifications
yes,
if you're going to go see them.
I mean, the public they want to know that they're getting taken care of well, that their doctor cares about them, is going to communicate their diagnosis and what they need to do to them effectively.
Now, pretty much everyone who's a board-certified allergist has passed your board, and they also enter into a process of recertification called the maintenance of certification. Yeah, could you describe that a little bit? What's involved in maintenance of certification?
So I need to refer to my chief.
Oh, by all means.
There's four parts to it, which is professional standing, where we ask that the doctor has to have a medical license that's active, valid, current, and also there's self-assessment part of maintenance of certification, where we look at CME credits for continuing education. There's some modules that assess the doctor's communication to the patient, and also the patient safety, to make sure that the doctor is keeping up with the current standards of patient safety. The cognitive expertise part of maintenance of certification is simply the proctored exam, which has been around since the beginning.
Yeah, it's that test that you go and you sit for. And
exactly, that super long test.
Yeah, that's online now, isn't it?
It's not online, it's on a computer.
It's on a computer,
testing sites all across the country.
So you don't have to fly some place to take it?
Hopefully the farthest you have to go is about an hour, 2 hours, depending if you're in the Midwest or the Atlantic.
Okay.
Practice improvement is the part 4 of maintenance of certification. So there's different modules that will give you, they'll ask for patient data and you set a baseline in your practice, and then over a few weeks or a few months you keep entering patient data and hope to improve upon your baseline that you set. Or another one is a patient safety immunotherapy module, so it's geared towards allergy and immunology specifically.
Yeah. Now, I've got an unlimited or a term unlimited board certification, but I plan to enter into this maintenance of certification starting maybe the beginning of this next year. It's a good thing to do. It's the right thing to do. What will I experience? What will happen? What will I have to do?
Well, the very first thing that we ask you to do is go on our website. We have a brand new web portal, which is portal.abai.org, where you can see your certificate information, your contact information, to make sure that we can get in touch with you. And it'll tell you what you need to do and the status of what you've done already. So you can upload CME credits on there. You can pay the annual MOC fee. You can upload a copy of your medical license. You can see which modules are due in which year and follow a link to sign up for them.
So there's like a menu that just tells me do this, and I just kind of follow the instructions.
Pretty much. That's what we're...
Well, following instructions isn't always easy.
No, it's not always easy, but we're all very, our office is small, but we're always willing to help. So we encourage people to call us, talk to us at the booth, email us, anything.
Yeah, so if I get confused, I can call you up.
Yes, and we're there to help, and we're always looking for suggestions with the web portal and how to make the experience more streamlined, more pleasant, if that's possibly conceived.
Wow, are you getting a lot of people recertifying now?
Yes, it's mostly time limited certificate holders. They're time unlimited certificate.
Well, they have to. So.
Right, exactly.
How about us older folks who aren't limited?
We get 5 a year right now.
So it's really not that much.
We're expecting it to increase because the maintenance of certification, we're going to be reporting people as active or inactively maintaining their certificate starting in 2011. So in 2010, you need to meet the annual requirements at the very least in order to be considered actively maintaining your certificate.
Oh, okay.
For time limited and unlimited holders.
Oh, so there's a reason to do it then.
And it's, the reason to do it is because you're showing the public that you've met these standards, that you're keeping up with the current knowledge in allergy and immunology. But also, there's talk about the state licensing boards requiring some maintenance of certification, and health insurance companies. They're talking about incentives.
Well, those are all threats, but who wouldn't want to just keep up with what's going on? I would think that would be enough motivation.
That's the theory. That's what we're hoping, and that's what we're looking for too. I mean, that's the kind of doctor who's going to intrinsically want to just maintain their certificate because
lifelong learning
standards, right? That's someone who the public's going to look for as well. That's the kind of doctor the person wants to go to.
That's the doctor I want to go to.
Exactly.
Well, very good. So if they want to find out more about the American Board of Allergy and Immunology, you go to your website, which again is
www.abai.org.
Well, that's easy.
I think
All
so.
right. Well, thank you so much.
Thank you. Appreciate it.
All right.